Andrea, are pregnant women more susceptible to the Omicron variant than either non-pregnant women or to other variants? Two questions there.
Thanks, Christoph, for your question. Well, it's a good question, and my answer is yes, or I would have to say, I think yes. To be honest, there is no data, published data, specifically focusing on pregnant women. But if we look at what we know about the Omicron variant, we know on one hand that the mutation of the spike protein has made it more infective. It has made it more efficiently replicating, particularly in higher upper weights, and on this basis, more infective towards other individuals. And at the same time, we know from published data, particularly relating to overall population and also on pediatric patients, that when the variant has started spreading in certain areas, there has been a steep increase of hospitalizations, and this is particularly true for children under 5 years of age and younger than 1 year of age. So on this basis, given that the Omicron variant is more infectious, and given the fact that an increased frequency of hospitalizations has been recorded in areas where the Omicron variant was likely to be spreading, I can't find any reason why pregnant women should not be more likely to get the infection and therefore be more susceptible to the Omicron variant.
So they're more likely to get Omicron than other variants?
Yes, based on what we know, that is the case. But
of course, we don't know if they're differentially more likely to get Omicron than pregnant and non-pregnant women, do we?
At present, we don't know. We know that this is more infectious for the general population and apparently also for the pediatric population. So on this basis, I can't find any reason why this should not be true for pregnant women as well.
Okay, thank you very much, Andrea. So clearly we need to learn quite a lot, which will no doubt we will find out about over the next few months. Let's move over to Raigam. Raigam, it's a two-part question here. When should pregnant women get the vaccine, and should the first trimester be avoided? Because I think there's been some miscommunication about the first trimester and the vaccine, but I'd be interested to hear what you have to say about this.
Yeah, that's true, and it's very important question that usually our patients make to us in the everyday clinical practice, and in general consensus from all important organizations, from available evidence, pregnant women should get vaccinated in all trimesters. That's the short answer. And there are some studies that have suggested that there could be a very immune response in pregnancy during the third trimester. However, most countries have limited resources and vaccine is not available whenever they want to get vaccinated. So they have a specific time points in which people are getting vaccinated, especially pregnant women. So if you have a vaccine available in your country and that's the only time period you can get vaccinated in any moment during pregnancy, it's okay. And about the question on the first trimester, if it should be avoided, there's no evidence that there's higher risk of any important adverse outcome if pregnant women get vaccinated in the first trimester. So I will say no, first trimester should not be, there's no problem with the first trimester, and it doesn't have to be avoided.
I think that's a very, very clear answer there. Have the vaccine when you can get it. The comments about the first trimester, I believe, were because in the first trimester, unfortunately, miscarriages are not uncommon. And the concern some of the vaccine experts had was that if a woman was vaccinated and then suffered a miscarriage, then it would be blamed, if you like, on the vaccine. But I think we've moved past that point now, and we can say that please have the vaccine whenever you can. Good, thank you very much indeed, Raigam. Let's move on to Asma for two related questions, related but different. Firstly, is there any risk, Asma, if the woman is close to her due date for either the woman or the fetus?
There is no risk of getting the vaccine at the end of the pregnancy or close to the due date, we know that the side effects from the vaccine in pregnant women tend to be similar to non-pregnant individuals. They tend to be mild. They don't have any effect on the pregnant woman or the baby. And therefore, the advice is never too late. Even if you are near the end of the pregnancy, still the advice is to go and get the vaccine.
Okay, very good. And is there any evidence at all that the vaccine will cause birth defects in the baby?
There is no evidence that the vaccine increases the risk of birth defects or congenital abnormalities. We have data from 13 studies on 100,000 pregnant women, and there is no evidence that the vaccine increases the risk of birth defects.
Thank you very much indeed, Asma. Again, very clear answers there. No evidence of increase in adverse outcome of birth defects. On that theme, we're going to move to Liona. So, Liona, we talked a moment ago about miscarriage. Is there any risk of the vaccine causing either miscarriage or stillbirth? Do we have enough numbers to be able to tell us the answer to that question?
Thank you, Christoph, and it's a great question. And to date, evidence based on real life population level data, institutional data, together with several case control studies from all over the world, demonstrated that the rates of stillbirth and miscarriage following vaccination against COVID-19 are not higher than the background rates. So it appears that there is no increased risk of stillbirth or miscarriage following vaccination against COVID-19. But perhaps, if I may, take this opportunity to highlight some emerging evidence showing that unvaccinated pregnant women have a 7-fold increase in risk in getting the infection compared to unvaccinated pregnant women. And amongst pregnant cases with COVID-19, actually 90% of SARS-CoV-2 related hospital admission and critical care admission are related to those who are unvaccinated. And the latest data suggests that actually women with COVID-19 who are unvaccinated have a 5-fold increase in risk of perinatal deaths, and that all perinatal deaths occur in pregnant women who are unvaccinated at the time of COVID-19 diagnosis. So it is critical that we address the ongoing low vaccine uptake rates in pregnant women.
Liona, thank you very much indeed.